Thank you for being here. Hi, everyone. Come on in, find a seat. I'm Dorian Traub. My pronouns are she, her, and I have the great fortune of being the Neidorf Family and Centene Corporation Dean of the Brown School. So I'm thrilled to be here with you today. One of my favorite parts of this job is getting to come and offer these opening remarks when we have such amazing speakers that are coming to share their wealth of information with our community. And I've really been looking forward to the discussion today because it, of course, also aligns with my own research interests in child well-being and family support and home visitation. So before I dive in and explain what we're going to be doing today, I have to stop and first acknowledge Gary Parker, the director of our Clark Fox Policy Institute, who invited Judge Missey here today to be with us. And I want to thank our co-sponsors for this event. So this event is co-sponsored by the Clark Fox Policy Institute, the Center for Social Development, the Center for Violence and Injury Prevention, Social Policy Institute, Herman Center for Child and Family Development, the Center for Innovation in Child Maltreatment, that was one name, the Center for Innovation in Child Maltreatment, Policy, Research, and Training, Center for Community Health Partnership and Research, and the Institute for Public Health. That is a long list of co-sponsors, right? I can honestly tell you I have never stood up before a crowd and had that many people co-sponsor one of our events. And what I hope that indicates to you is that the Brown School really, really cares about families. And we are deeply invested in ensuring that they have what they need to thrive. And today's speaker has dedicated his entire career to that same mission. Judge Darrell Missey serves as the director of Children's Division at the Missouri Department of Social Services and has a long history of working with families and at-risk youth. In 2002, he was elected Associate Circuit Judge and was assigned to the Juvenile docket. Before you all arrived, he was regaling me with some pretty interesting stories about his time on the bench. In 2014, he was elected circuit judge and served as the presiding judge of Jefferson County from 2016 to 2020, during which time he also served as the administrative judge of the family court. During this time as judge, he served on Missouri's Family Court Committee, the Juvenile Detention Alternative Initiative, Replication Team, the Detention Standards Review Committee, and the Children's Service Commission. That is quite a resume of service. He left the bench to assume the duties of director of the Children's Division for the state of Missouri in January 2022. With that, it is my pleasure to welcome a man whose dedication to family preservation might only be rivaled by his patience when having to explain to anyone who asks the intricate and complex details of Missouri's child welfare system. He is not just a guardian of children's well-being. He is also our guide on a journey towards a state where every family has the support that they need to thrive. Please join me in giving a warm Brown School welcome to Judge Darrell Missey.
Can you hear me now? All right, great. It's great to be with you. I have died and gone to heaven. I mean, to be able to do this kind of thing on a college campus, it's like, oh my gosh, I'm just I love being here. So I told me how this room reminds them of Hogwarts. So and I am old enough now to be Dumbledore. So I guess it's okay. I guess it's all right. So I appreciate the chance to come and give this talk. And really, what I'm I was a judge for 19 years, and people were like, you're going to go be the director of a state agency. What are you thinking? What are you thinking? And I'm asking myself right now, what was I thinking? And it's the chance to do reform. I mean, the whole reason was to do reform and to work on prevention. So I'm gonna go through these things pretty quickly because the most fun part of this is, I hope, going to be the conversation we have. You know, I just love to hear you. That's when I can get into old law stories. It's a lot of fun. So, does this thing work? Does it work, Stephanie? It's me and technology. It's really a terrible thing. Yeah, I learned a new word a few years back. It was Luddite, and a Luddite is a person who hates all new technologies. And I thought, huh, it's me, and they're talking about me. Is there a button I can just hit? Okay. Now it's working. Okay, my disclosures. I have no research support. I have no consulting relationships. I have no stock equity. I have no speakers bureaus. I'm nobody. That's that's great. All right, so this is the cover of a document that we created to a plan to rebuild and reform Children's Division, and it didn't always look like this. It originally looked like a legal document because it was written by an old lawyer, me, and our director of our department, gave it to the comms people and said, "Can you make this pretty?" And they did, and so it looked like this, and it's got all these pictures and everything else. And we presented it to the legislature, and to really quickly summarize it, basically it said this: legislature, we need more money. And what we would do with more money is actually be able to pay people enough that they could stay. So that we could get some stability in the workforce. We need more people. Please give us more people. They did that by giving us more contractors. Tell you what, I'll take it. But what we also asked for and what they gave us was 100 new people. 100 new full-time employees, which I'm told in state government is unheard of. It doesn't happen. They just cut that, but they gave us 100 new people, to which we're dedicating to prevention, to getting out front of these cases and doing prevention. Now, in a grand scheme of things, I've talked to people in other states. Our force is probably half the size it needs to be to do the jobs they've given to us. So what's 100 new people in a 1,400 force? What's that going to do for you? It's like you had a football game and football game, and you're playing a football game with 5 people, and they've given you a 6th person. That doesn't help any. You're going to get crushed. You're still going to get crushed. So unless you don't put the 6th person on the field and you have the 6th person work to turn the football game into a basketball game, then you can do something. So that's really kind of the strategy. So we got 100 prevention workers. We're going to get out in front of these cases and do the things that all the studies and everybody else ever tells us that we need to do, which is go upstream of all this and work with these families before it gets to the point where you're doing a hotline. Right. So we'll get them upstream. In addition to that, we got 34 lawyers at the Division of Legal Services. I was actually asking for lawyers I was asking for people for other divisions, and they would come into our cases and get these cases done when they're ready to be done. I mean, when kids are ready to go home, argue to the court that that's what ought to happen. When you're ready to have a guardianship, when you're ready to have an adoption, have lawyers to do that. The idea being that we will slow down the number of kids coming in to make sure we've only got the right ones here, speed up the people going out so you don't just linger in a system, which isn't healthy or good for you, bring the number of cases down so we can actually have workloads that are workable. And once we get to a place that we have fewer cases than we actually need, we can start converting people from foster care management to prevention of abuse and neglect. That's the nutshell of it. And the interesting thing is we've got of the 100 people, the governor let us ask for $22 million. His recommendation was $22 million to the legislature. They gave us 33. And so you're going, woo-hoo. I was sitting in the Senate meeting, I was hearing what was happening. I was like, oh my gosh, this is an amazing thing. It's Christmas. It was really, really great. And so we're going to really work on preventing foster care and making it and changing the child welfare system in Missouri. So we're working to prevent foster care. But the question that often comes up with people, and not people in the field, they knew. But the question is why. I love Simon Sinek's book, Start With Why. I think it's a great, I love the title because it's always great. If you start with the question why. Why would you prevent foster care? I mean, if we're doing foster care, aren't we keeping people safe? Isn't that the idea? We're doing child protection after all, right? Wouldn't it protect them to put them in foster care? Well, no, you'll learn what my personal experience was, and then what the studies show is that it's not nirvana. It's kind of a tough thing. So there are good reasons to avoid foster care. And one reason is it involves trauma. It hurts. So I use a medical analogy all through this because I've got a buddy and actually here in the same with whenever I'm here in the St. Louis area, and I talk to him about this stuff, and he's a hospital administrator, and he just always throws out medical analogy. Well, you know, if you did this in medicine, it would be like, and it really makes sense. If we're really doing treatment, that's really a thing. So what he told me is this extreme intervention of getting into somebody's family and taking their children away and mixing, you know, it's a big thing. It's like surgery. It hurts. It's like surgery. It hurts. And he says to me, you know, Darrell, everybody who comes in here with a serious condition does not get surgery. Because why? Because surgery comes with risks. It's a trauma. And you got to ask yourself, is the trauma of the surgery worse than the thing we're trying to cure? That's what you got to ask yourself the question. He says the same thing about medicine. He says, you know, every medication, he says, Nick, I'm talking about Kevin Sprecher. All right, one of my neighbors is in here. He said, you know, Darrell, every medicine's a poison. It's just the poison's in the dose. You know, it's only curative at a certain level, and then later it becomes a problem for you. So where is it? And you know this from watching television and commercials, right? You've seen the commercials. You know, take Chilantrix, and they've got all these pictures of people frolicking through fields and all this happy stuff happening, right? And then they get to the happiest part of the video when they tell you, warning, Chilantrix hasn't been known to cause hair loss, skin lesions, liver failure, and death. And it's like, ask your doctor. Oh, really? Wow. Okay, I'll ask my doctor about Chilantrix. You know, everything has side effects. What are the side effects of foster care? Now, if you talk to people in the field, and we're not using data, I'm talking about just their life experience. Here's what it is. They're heartbroken, they're in grief, they're traumatized, they're scared, and they hate it. And you talk to kids, what do you want to do, have happen? I want to go home. Where's my mommy? You know, what has happened to me, right? Well, there are studies that show what it is. And these are some of them, the risks of foster care. Now, this is from an article by Professor Shanta Trivedi at the University of Baltimore School of Law. And for full disclosure, I did this at the medical school and had an email exchange with Dr. Johnson Reed later. She says, you know, well, they didn't analyze that, and they could have analyzed this, and this was different, and everything. Like, I'm like, oh yes, professor, thank you. The data is probably right, but what I want you to understand is looking at it from perspective. Who Shanta Trivedi is? She's a lawyer. She's not a social worker person like you, and she's not an analyst like Dr. Johnson Reed. She's a lawyer, and she has seen what she has seen, and she's like, I'm going to find the studies that make the case. And it's 50-something pages long, it's 400 footnotes of things that happen. And I think though you could question some of the details of the data of this thing, I think there's no question this is traumatic for every kid I ever saw. They were all traumatized by this. And having PTSD, you know, one study says they're twice as likely to have PTSD as if they went to war. Now we're not talking about, you know, oh, gee, the trauma of their childhood has caused this stuff. No, we're comparing similarly situated children. You know, they're more likely to be addicted. They're more likely to commit crimes. They're less likely to complete school. They're more likely to be unemployed. I mean, you just go on and on. More likely to be homeless, mental illness, 7 times the rate of depression. Why would that be? Well, if you've been in the field, what did they lose? What happens to and understand that all that history and all those committees and everything else, that's not really where I learned this. I really learned this being a really young lawyer, being thrown into the mix, and being a guardian ad litem for these kids, being their lawyer, and actually talking to them, and then being the judge and actually talking to them. It drove people crazy. I want to see Susie, and I want to ask her how she is, you know. And here's what they tell you: the list of things I'm going to tell you that happens to them has come from their mouths of things they've lost. What do they lose? They lose everything they've got. They lose, first of all, they lose their mom and their dad or whoever was their caretaker. And regardless what happened and regardless almost always, they love them and want to be with them, right? Almost always. And then because we don't have enough foster homes, we have trouble keeping sibling groups together. So they often lose their brothers and sisters. They lose their house, they lose their yard, they lose their room, they lose their toys, they lose their stuff that they can't fit into a regular sized kitchen trash bag. They lose their dog. Do you know how many times I've had kids crying to me about their dog? I will tell you, I have entered orders placing children with their dog Like, what, you're going to place with Fido? I did, because it was sketchy aunt would keep the dog, and people were like, oh, I don't like her background. I don't care. You know what? She's in the school district and she'll keep the dog. Oh, by the way, you got any foster homes down the street from where this kid came from? The answer is no. So now they've lost their neighborhood, they've lost their school, they lost their teacher, they lost any activities they might have been involved in, and all their best friends. And you wonder why these might be the outcomes. So what do we do? What do we do about that? There are biochemical things with regard to this. This is from another article. This is a professor from Harvard Medical School that says there's so much research on this, meaning to say removing of a child from somebody, that if we paid any attention to the science, we would never do this. Why? Because they're awash with stress hormones, and it changes brain chemistry, and it does this stuff to people. But here's the deal. We've got to do it. We've got to do it. But the question is, in what measure do we have to do it? And it doesn't tell me what the next slide is. That's okay. In what measure do we have to do it? And how do we do it when we do it? So we have to do it. But how much does Missouri do this? Some of you are national people and you're interested in the nation. I'm listening to all these podcasts, and the United States does this more than anybody, and it's just terrible and everything. But Missouri is way out of whack, even compared to the United States. This was given me to folks from Casey Family Programs. And so Fred Simmons was our Casey guy at the time. He's since retired. He came into my office, and he'd been the director of Children's Vision once, and he gave me this chart, and he says, "Well, Darrell, we don't tell people, does this little light work?" Yeah. Oh, look at that! I'm so excited. All right. I'm such a nerd. Give me a dry erase board. I'll go crazy. All right. So Fred gave me this, and this line right here is red. That's Missouri. And so he says, yeah, we don't put the names of the states on here so that people don't know what we don't want to malign anybody or anything like that. I said, Fred, it's Alaska, West Virginia, Montana, Kansas, Missouri, Indiana. He's like, how did you know? I said, Google, man. I was interested, and I looked at it, and I compared it just with the population, not the child population, but I knew where we stood, and it's outrageous. So when we started this in 2000, at the beginning of 22, Missouri was 5th in the nation with double the national average kids in care per capita, 10 per thousand. That's 1% of our child population was in state custody. We have marginally improved. We're now 9.1. Actually, we might be better than that because I've not seen this lately. 9.1 per thousand. So we're no longer the 5th worst in the nation. We're now the 6th worst in the nation. So Indiana, take that. All right. All right. But what you look at is up here, these are really effective places, which, by the way, are not just rife with abuse and neglect and children dying and all that. They're not. And they are, the top ones are New Jersey, Maryland, and Virginia. I'm really interested in Maryland. Why I'm interested in Maryland? Maryland is demographically very much like Missouri. Same size, interestingly similar mix of urban and rural, just a whole lot of things exactly the same. And oh, by the way, they plummeted from the neighborhood of 13,000 kids in foster care to under 4,000 kids in foster care in a decade. And so I've been talking to people from Maryland about how they did that and what they did that. But we could be Maryland. Okay, so looking at these effective systems, these up here have 1 to 3 per thousand in care. Alaska's 20, Missouri's 10. We're double the national average. That national line is 5 per thousand. So I've been been to localities and say, where are we? So here's what the numbers say. Effective systems are 1 per 3 per thousand. National average is 5. Missouri is 10. St. Louis City is 14.42. Hannibal is 29.54, nearly 3% of the child population. You're thinking, why in the world is that? They're not the only ones. And I've been to Hannibal and I've given this talk, and boy, you should see the look on their faces. They're like, what, really? Ah. Right? Yeah. It is. I think if you look at a map of Missouri, now this has older numbers on it, but the darker places are the places where you have higher numbers of kids in care per capita. It looks to me like population centers with service deserts. Really rural places where we've got Interestingly, you got Hannibal. There are a lot of people in Hannibal. There's not a lot of services in Hannibal. You got Kirksville. It's a college town right there. That's where I went to school, right? What in the world are they doing up there? Their numbers are coming down, by the way. Moberly, Poplar Bluff, Rolla, another college town, 27.12. So what is happening? So we are looking at ways of getting people services into these spaces. So my friend Kevin, the hospital administrator guy, he asked me, so what's your process? How are you deciding which kids come into care and which kids don't come into care? How do you decide this? And I said, Kevin, we don't have a process. We don't have a process. We are running around. Well, actually, what I told him first is I started talking to him about the law. I said, well, the police officers come and they can sign a 33, or a juvenile officer can take custody, or we can do an investigation, and then we have to make a request to the juvenile officer, and then they go to a judge and they get an order, and then they within 24 hours of taking custody, and then within 3 days you got to have a protective custody hearing. And he goes, no, counselor, what's your mental process? What are you thinking about before you do this? I said, we don't have a process like that. We're running around like chickens with our heads cut off to see whether they're safe. And if they're safe, if they're not safe, we put them in foster care. If they are safe, we do nothing. That's the process. That's not a process. He goes, oh yes, it's a process. He says, you've got to be able to describe what you do as a process. He quoted this guy named Professor Deming from NYU, who says, if you can't describe what you're doing as a process, you don't know what you're doing. That's probably true. He goes, you need a good process. Then he goes to sports. Nick Saban, you got to have a good process. Okay, so University of Alabama won some games. You got to have a good process. So what's your process? And I explained that to him. I says, I don't think it's a process. He says, yes, it is. It's a very terrible reactive process, but it's a process. Here's what it looks like. We'll do process mapping. I'd never done process mapping before until I did it with Kevin. I did process mapping. So here's what it is. There's a report to Children's Division, and we ask, are they safe? And if the answer is no, they go to foster care. And if the answer is yes, we do nothing. That's a process. He goes, that's a terrible process. I bet you got tons of kids in foster care. I said, yeah, how you know? He goes, well, let's talk about it if it were medicine. He always talks about it as if it were medicine. He said, well, say it's medicine. You come to the hospital. Are you dying? Yes, you get to come to the hospital. No, do nothing. You know what happened? They're coming back. They're coming back. And they might be dying, so they show up at first, and they've got a nasal. They've got a nasal infection. Oh, you're not dying. Go away. I come back next time. Oh, now it's spread to your throat. You're not dying. Go away. Oh, now you've got bronchitis. You're not dying. Go away. Oh, now you got double pneumonia. Now I'll let you in. Guess what? Your survivability isn't going to be great. This is a terrible process. So, anybody remember this? Anybody remember I Love Lucy? All right, so some of us who are old enough that you're either watching TV Land or whatever, but this is what it's like. So if you watched I Love Lucy, this is from an episode. I was going to embed it into the thing, and it wouldn't let me do it. But there's this episode of I Love Lucy, who is here. Lucy's here with Ethel, and they went to get a job at a chocolate factory. And their job was to wrap the chocolates as they came down the conveyor. And this very mean-looking boss says, you cannot let any of these chocolates get past you. None. Let it roll. And it started, and Lucy said, I can do this. We can do this. This is okay. We can do this. And then they came faster than they could come. And so then Lucy and Ethel both, they start to cram the chocolates down their shirt and in their mouth and in their hat and everywhere else to try to avoid it getting there. And this is what's really fun, is this was before a real live studio audience, and you hear them losing their mind with laughter because it was utterly hysterical. I mean, it wasn't a laugh track. I mean, people were really, you could hear them, they're falling down, because this is Missouri's child welfare system. Right here. This is Missouri's child welfare system. Because look, we got too many chocolates on the conveyor, and we can't let them get past us. We can't let them get past us, so we're just putting them everywhere we can. We don't have foster homes, we don't have things, we're cramming people here, there, and yonder, and it's funny, but it's not, because it really is the way things are. So what we're trying to do is we're trying to change that process, that reactive process that results in us being like Lucy. And so we're doing prevention by engaging at-risk families, trying to provide people with other avenues for help besides the hotline. Lots of people call the hotline. They just want to help. They're concerned and they just want to help. They don't think there's been abuse or neglect, but they got to do something because they're worried. All right. Give people other avenues besides that. Now, don't hear what I'm not saying. There's abuse. There's neglect. You call the hotline. Identify help in the community and find the least invasive intervention. So we got prevention workers, those 100 prevention workers. What are they going to do? Well, they're going to do team decision-making meetings. They're going to do family-centered services and primary prevention. And I was talking with these folks before we started. The great thing about this is that the legislature very wisely baked this into the budget. It's in the budget. 20 of these people have to be team decision-making meeting people. 20 of them have to be family-centered service workers, and the rest are prevention workers, and that's how they're designated. And so nobody can just take these people away without going back to the legislature. And the hope is we'll get more, because as we convert the system over. So people were interested in the Family First Prevention Services Act, which I think is just a landmark statement of the direction we ought to go. And it's very hard to access because we're trying to access these dollars. So it provides federal match for state-funded prevention services that are in the clearinghouse. What services does Missouri have in the clearinghouse? Nothing. We got nothing that's in the clearinghouse. Our Family First plan had two counseling interventions. We're in the clearinghouse, but we don't actually have either of them in the state. So we're having to get people to try to ramp those up. We have transition dollars, which were given to us to try to actually do some grants to develop community placements and therapeutic foster homes. That's what TFC is. Consulting for development of community placements and development of new programs. So that's sort of where Family First is. But you hear people talk about Family First, great idea. Federal government classically just makes it almost impossible to do in some places. And so we're getting consultants and we're getting help to try to help us move this thing. But understand, it's not magic either, because it's just a match. Missouri's got to contribute to this. And I think we can talk about how to get them to contribute to this, because ultimately it makes more economic sense to do this prevention stuff this way. So it will impact reporting, but there were people out there saying, they're telling people not to call the hotline. No. So I made this slide to say, when do you call the hotline? Always call the hotline. Always, always, always call the hotline. When do you call the hotline? Always. If there's suspected abuse or neglect. But define that rightly. What is that? It's not poverty. It's not addiction. It's not mental illness. And this system is completely fueled by poverty, addiction, and mental illness. So what I'm telling people is get to know your prevention worker. There are going to be like 12 of them in St. Louis to start. In the metro area, which is not enough for 1.5 million people. But guess what? When you're looking, you only got 100 for the state. It's a real start. So my friend asked me, what kind of system would you want? What would you want? Before we map it, what would you want? I said, here's what I want, Kevin. I would like a system where, okay, if it's an emergency, if it's a broken bone, if it's sex abuse, if it's the stuff that you hear about on TV, that you call a hotline, you actually get through, and Batman shows up at your house, okay? I mean, we are serious about it. It's like the red phone is flashing, and in we come, and we do what we need to do. But that's not the majority of our cases. Next month is Child Abuse Prevention Month. We talk about child abuse all over the place, all the time. We talk about it and talk about it and talk about it and see precious little of it. I mean, as compared to the other stuff. As compared to the addiction and the mental illness and all that. So I would like for all the rest of the cases that come into this system, the other 9 out of 10 cases that come into the system, I'd like us to have a meeting. Let's have a team decision-making meeting. Let's have a meeting and let's talk about it and let's ask some questions. And you know the questions I like? I call them the Iowa questions because they came from Iowa. When I came to the director, had a talk with the director in Iowa, she said, Darrell, I'm sending you an electronic care package, but I want you to pay attention to the questions. So what, in certain places in the state, we ask these questions before we take a child into care, and everywhere we do it, it cuts the number in half. And I said, really, what are they? He said, well, here are the questions. What if we remove the danger instead of the child? Or how about somebody else can move into that house that would make it safe for that child? Or one of the parents and the child can leave the house and it would be safe. Or you do a temporary placement with a relative or a friend, what we call a TAPA, temporary alternative placement agreement. What about we do that? And when we do it, when we ask the question, are they safe? If the answer is yes, we don't do nothing. We say, how'd they get here? Why do we know about them? What services can we give them? And then if we do one of those other things that I talked about from the Iowa questions, we don't then do nothing. We then send them to services and ask how we can help them. And then we know what we do? We follow up and we ask a question, did that work? And if the answer is yes, great. And if not, let's have another meeting and see what we can do differently. And he says, well, let's map that. And what would it look like? And it looks like that. Now you'll notice, the thing you'll notice about it is it's more complicated. It will slow this thing down and it's more thoughtful. So, Are you safe? Yes. Okay, we're not going to do nothing. What are your services? What are the things that we can put you with that will keep you safe? Are you safe? No. Well, can we make you safe by removing the danger or having a parent leave with you or doing a TAPA? Can we make it that way? Would that be different? You know, there are only 3 of the 4 on here. And the reason there are only 3 of the 4 on here is I ran out of space on my slide. So that's why that is. But we made this box red. We made it red because my deputy director of prevention, she said, this is the key to the whole thing. And guess what? We don't do it. Children's Division doesn't do this stuff. We do a little bit of it. We do some family-centered service work, but mostly we're going to be talking to people, supports in the community, you know, organizations that you have here in St. Louis, you know, the charities and the churches and the community groups and anybody who will help us take care of a kid and a family. They're in this red box. And how can we fill that and make that happen? And sometimes we're going to have, the answer is going to be no, 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 no. And then we're going to make a referral to the juvenile office and have those kids come into care. And then we're going to try to help them there too. So if we did this, the road to excellence passes through mediocrity. If we could just become not great, let's just be mediocre. Now let's just use St. Louis's numbers. We don't get great. Currently, 848 kids in state custody in St. Louis. I think the number currently is a little better because we're moving the ball all the time. I mean, we're really starting to see impact. If we just got St. Louis from 13 kids per 1,000 to 5 to the national average, we would have 634 instead of 848. And the people who are taking care of those extra couple hundred kids would be shifted toward prevention to help us further reduce it, to help us further help people. If we got to the national average, which by the way, I consider to be a C, that's passing, but it's a C. If we get to a place where we've got a C, it's 317. Think of the work that we could do if we only got that number. But that's not it. That's that Maryland, which I keep talking about Maryland. Maryland's rate is 2.67 per 1,000. If we were at Maryland's rate, instead of having over 800 kids, we'd have 169. And it would, and that's 600 however many kids that are not traumatized, that we didn't do all that stuff to. Now, some people say, well, that can't be safe. That cannot possibly be safe. Well, yes, it can. Another article I read was about New Orleans. New Orleans is interesting because a judge there basically wiped out foster care. Judge Ernestine Gray decided, I'm going to apply the law, and we're just going to basically wipe out. You know, if you got a child in custody, it's because it's unsafe and we don't have a choice. And so she started applying the law, and the number went down. St. Louis has 350,000 people. New Orleans has 400,000 people. St. Louis has got 800 kids in foster care. At her lowest rate, Judge Gray had it down to 20. 20 kids in care. At the time of the article in 2020, there were 49. Now, some people might say, well, that can't be safe. That's got to be dangerous. Children had to have died. It can't be right. Well, guess what? Guess what the data actually showed you? The number of recurrence of abuse and neglect in New Orleans was no higher than anywhere else in Louisiana. Here was the interesting thing. All-cause mortality actually went down. Why? Maybe because we're not traumatizing those kids. So this would save a bucket of money. I hear it costs $30,000. You know, if you want to be crass about it, if you want to try to convince people who have the money, $30,000 per kid to keep one child in care. When one of our causes of neglect is poverty, what in the world are we doing with our resources? If it takes $30,000 to keep a child in care, if we've got a mom of 3, we're going to pay $90,000 a year to take her children away because she doesn't have housing. How much housing could we buy for her with $90,000, or say $20,000, you know? So, you know, it's $375 million a year to take them into care. My whole budget, the entire budget that Missouri has to take people's children away is over $600 million. We could save $165 million a year, plus the subsidy payments, would mean to say once these cases go to permanency and they go to adoption or guardianship, we keep paying subsidies. We pay $133 million a year in that, plus the long-term trauma-related costs. We will save people's lives, save people's hearts, and save people money if we do this differently. So what I'm asking people to do is fill the red box and make a difference for our kids and our families. We're beginning to see it work. In Kansas City, I was told by our regional director last week, I've moved our first people. We've moved our first people from foster care case management to prevention. I almost cried. I thought, it can work. It can work, and we're starting to see it. So that's what I have to say. How much time do we have for discussion? We got 20 minutes, so I timed that about right, right? Grab a mic, okay. So you'll play Phil Donahue? I've been known
I
to do
like to
that.
think of myself as the white gay Oprah.
Oh,
Actually,
okay,
it's a
okay,
little
okay, okay.
different.
I'm all for that. I'm all for that.
Hi.
Hi.
So I'm Sarah. I work in healthcare. And we work at a hospital that has all complex medical cases, children. And while I totally think it's great that we are shifting to prevention, we definitely have this pocket of kids that cannot remain in their homes safely.
Right.
So are there efforts going to be made, because we need medical foster homes?
Oh, yeah.
We don't have anywhere. We have kids sitting in the hospital for years because we don't have anywhere for them to go. They're growing up in an institution. They're not. You want to talk about trauma, a child growing up and living in a hospital for 5 years, that's
Right.
trauma. And so I think we see a real hole for these kids who have these complex medical needs. They're on trachs and vents and feeding tubes, and we have no providers. And their families simply can't do it. That Children's Division has gone through the process of trying to put those services in place. And I think we are excited at the idea that there might be more resources. And I think we would put an extra plug in for our families who have complex medical children, that there's more that they need in particular to be able to take their kids home, because they just can't do it. And I mean, we have parents come to us and say, I'm giving you my child. I'm not taking them home. So, yes. So my question is that a focus, our complex medical kids?
It's a piece of the whole puzzle, which is we don't have placements. We got kids staying in offices. We got kids without any medical things staying in hospitals because parents will drop them off at the emergency room. We have that. I get emails from hospital administrators all the time. Oh, little Billy's 10. He's been here 2 weeks. How do we get him out? The hope is this, and it's never going to be perfect, and we're always going to have these kind of problems. The hope is as we reduce the number of kids in care, our ability to ramp up the capacity for special needs kids, for the kids that we really, really need, will go up. But, it's a piece of the puzzle. Any thoughts or questions? We got 20 minutes, man. I'll start singing songs if we don't have some.
Oh, please have questions.
Hi, I've actually worked in alternative care in the county and in the city. And I think, as social workers, a lot of us do think that prevention is the right way to go. And I'm assuming to get families moved over to a prevention more than being in custody would require the court system to also agree on that. And I think St. Louis City does a pretty good job, but in the county, not to be rude, it's kind of
Be as rude as you want. Go on.
it's hard to express your feelings of wanting children back in a home when there's people who have been in the court systems for a while who haven't seen the kids in about 3 years, who are disagreeing with you, especially I'm a very young social worker, so I don't know if my opinion always holds the same weight, even though I'm interacting with the family on a pretty regular basis.
Thank you for that. So, in the child welfare space, I'm not really an expert about much, except for that court. I know that court, and I know it doesn't have to be the way it is. I also know that it is different in every one of the 46 circuits. And the reason it is so different in every one of the 46 circuits is because we have this structure where the juvenile officer actually works for the judges. And so it creates, they sort of have they have super influence on what happens. So how it happens in your space depends on your juvenile offices, depends on what they're advocating, depends on the guardian ad litem, depends on how the judges are reacting to them. I used to, and you can ask the people at the juvenile office in Jefferson County, I consider them friends and colleagues, but I have ruled against them a lot. But there are places that it doesn't happen. And so what I'm telling our people is that, look, this is why we have these lawyers. We go to court. If we're right, we think we're right, there's a time to fight. I'm all for collaboration. I think it's just beautiful and wonderful. But your voice is going to be heard if it's the last thing I do in Missouri. And we can get ruled against, but we're not going to be ignored. So say what's on your mind. Never fear saying what's on your mind, and make the judge tell you no. I've had people say, well, we're not going to file that because the judge is just going to say no. Make them tell you no. Make them tell you no and no and no and no. File the motions. And if it's bad enough, we'll take it to the Court of Appeals. And if they tell us no, we'll keep doing it because it's the right thing to do. And if we don't do that, the court is supposed, from a governmental philosophy perspective, as a judge, the Federalist Papers tell us what it's supposed to be. Courts are supposed to have, Hamilton wrote it, I believe, no force, no will, only judgment. To make that happen, probably somebody needs to work on the structure, but we at very least need to give that court the opportunity to make judgment and not just roll over. So thank you for that question. It's a great question.
Hi, Mary Quant with Missouri Appleseed, and actually building directly off that question, Missouri is one of the few states that has the juvenile office underneath in the judiciary as part of this child welfare system. What are your thoughts on any changes? Like, is this a long-term feasible solution to have the juvenile office, or is it better to move them into more of the administrative law side of things? I know it's a really tricky question.
Well, no, it's not a tricky question. It's an actually excellent, straightforward question, but it gets me in trouble. Because people don't like my answer. And I don't shirk away from it because I love the fact that we have a juvenile office because they can act as a filter and work on due process and really help us engage the courts. And I've got many friends who are juvenile officers. Nothing against them personally. This structure, in my view, and I've said it for 30 years, so I can't unsay it, is unconstitutional. And I think people need to start challenging it. I think there are legislators who have started to talk about it. They belong in the executive branch of government. People ask me where. I say, I don't care. I don't care anywhere, but not because the judges or the juvenile officers are doing anything wrong, but because they're human beings and we deal in a world where the founders understood it. The founders understood. And, to cite the Federalist Papers again, they said where the executive function and the judicial function are in the same branch of government, there will be tyranny, period. And so what we have to do is what we did in the courts, what we did in Jefferson County was I declared that I, as the judge here in the case, am not going to have anything to do with what the juvenile office does. You're going to answer to the presiding judge. But what I noticed was they still spent a lot of time trying to make me happy. So I thought it was great because it was me. But if it were somebody else, so that structure needs to be worked on.
Following up on process, what about information technology to empower your team to be effective in not only case management, but also just the process of getting into the system, and then downstream collaboration with the public health administrators at the county/city level and all the service organizations in these communities?
The only thing I found that everybody in the field agreed about is that our computer system is awful. FACES is terrible. It's awful. But we are working on building. We've got money from the legislature, and we're working on building what we call a CWIS. So if you talk about CWIS, it's a Comprehensive Child Welfare Information System, CWIS. And we're working on building one now, and it will hopefully have a whole lot of that. People are talking about using algorithmic and artificial intelligence things to help us to know that the likelihood of safety is high to prevent us from reacting with our own personal fears. That could work the other way too, but there are conversations. There are conversations about all that, and we have technology meeting every week now, and I'm hopeful. It's going to happen.
I have a question about the prevention piece and in this model. I've seen cases that, do go on and kids do enter care because of safety issues and some of these things, they can't be removed with the parent, so forth, but that a parent still wants to get them back, wants to, work whatever plan the court gives, but the same reasons that cause the home to be unsafe is preventing the parent from fulfilling those services, from showing up for drug testing, whether it's transportation, all these barriers that they want to, but they are so overwhelmed with their life that they can't often do that. Will prevention help families work those plans as well? Or is there talk about providing services to help families get?
Well, the hope is, okay, so really, there are people who say what I'm talking about here is not really prevention. This is diversion, right? Which I think diversion is a form of prevention. But what you're talking about is, we're talking about prevention. It's over here. It's before even this report, right? So when it comes after, when there's been a referral to the juvenile office and they go into care, we're still going to be going to that red box, for services. And we don't have, so we just had the federal review, the CFSR, the Child Family Services Review. We just had that. Missouri isn't doing too great on a whole bunch of measures, but one of the things they say they want us to ramp up our service array. And what's your service array? And I thought, an array. That's a big word to use for Missouri's. An array means a lot of things, a large variety of things. We don't have a service array. We've got a service smattering. And so, we need to build a service array. And that service array will be in that red box, and I'm hoping that it will be helpful on the front end, but it'll be helpful after those cases come in too, because a lot of the kids that we have in care are lingering. By the way, we've reduced the number of kids in care in Missouri since I started here by 2,000 children. So we've moved the ball. I mean, the people have moved the ball, and it appears that we're moving the ball by moving cases out, by getting cases done that were in a log jam. And so I think we've got the courts to thank for that because they're moving that ball, but they can't move those cases if they don't have those services, which you're absolutely right. I'll repeat the question if you want. Yeah, go ahead.
Yeah, I have who will make the referral to the prevention services? That's one question. And then the second question is how will I'm glad for the prevention services and everything, but I still see a lack of affordable housing and providers who will accept Medicaid. And I often thought that if every provider would just, if we would have sharing, if every provider would just accept maybe just 5 clients on Medicaid and they can bill insurances, everybody else, then that would provide that would be sharing the, instead of everybody having to go to Compass Health or Chestnut Health, or we all know the providers who accept Medicaid, but there should be more.
So we're in the Dumbledore room. So I'll wave my magic wand, and make it the way I'd like it to make it, right? If I could wave my magic wand, here's my hope. My hope is a whole bunch of people who are now mandated reporters will become mandated supporters. They'll feel compelled to help. And one of the things that they can do is they'll know what all the services are in that box and they can make direct referrals. But the other thing is that they'll know who their prevention worker is and they'll have one. They'll own them. They'll be like, we got our prevention worker. He's awesome. We like him. His name's Bill. We think he's great. My hope is that happens and they go and say, hey, we've got this thing, and that person becomes an expert on what services are available in that community. And we'll get people to them. If I had a magic wand, that's what I'd like to have happen. Yeah.
I thank you. Really, really appreciate this. And okay, thank you. And just want, as I think about this and love the focus on prevention, we need more community supports. We need more prevention prior to the report to CD. And so one of the things I've always grappled with as a report to CD as a means to access services.
That's right.
And that just shouldn't be that.
It should not be true.
The case.
That's right.
So prevention, how can prevention specialists be engaged with prior to that report?
Our plan is to put them in the places where the hotlines are most likely to happen. So housing them in hospitals. We had a talk, Dr. Tanda, good to see you. We had a talk over at the medical school about, and we talked after, and they're like, do we get our prevention worker? Where's our prevention worker? We want a prevention worker. Yeah, you're like, yeah, okay, you can have a prevention worker. You just wrestle with Cardinal Glennon for the prevention worker. Maybe we can get 2 in that place, but we're talking about school districts. Talking about working with schools, housing them in schools and in hospitals and police stations. And so getting them to be a part of that community up front so that people know they don't have to call the hotline just because a person is poor, addicted, or mentally ill. That you can get with that worker who can hold a team to sit. By the way, we intend to train the whole entire force on team decision-making meetings. We can hold a meeting and we can get you referred to services, and it'll just be it'll be a different approach. And it won't change the whole thing. It'll only change a percentage, but that change of that percentage will make a difference for the whole thing.
So thank you for this. I've been around, I'm not a new social worker. I remember Senate Bill 595 in late 1990s that did exactly this, and it worked really well, and then the funding went away. So I'm thrilled that there's $33 million now. I am concerned about sustainability, that we don't lose what this can be, because this is a model that we've used before, and it worked really effectively as a pilot, and then it didn't get funded.
Right. So the $33 million is a drop in the bucket from what I really wanted to ask for. You know, I mean, it really it sounds like a lot of money, but for a state this size with as big a budget is, my hope is that a lot of this stuff in this red box is not the government. And we need to ramp it up. We need to ramp it up. And I'm going to argue, so long as I'm around, I'm going to argue the second they're going to cut off bite their face, because it costs $30,000 a year to keep a child in care. This is more cost effective. And by the way, legislators are hearing that. They're hearing it, they understand it, they get it. They really, really get it.
Are you involved in any kind of evaluation process that will be able to let these legislators know about the success? You know, as the program moves forward.
Well, right now, I've got that document that we had up there, the plan. There's a plan phase 2, and at the front end of that, we show them some of the data, and one of them is this ski slope looking thing of the number of kids in care coming down. You know, that itself is a measure that really matters. But I'm hoping to partner with a lot of people, like maybe some of you WashU types, to analyze this and to show the data, to preserve the policy. Because I would like a decade from now for us to say, this was a good moment, and that is good work, and look how much better Missouri is now. We're up at the top of that chart with Maryland. How'd that happen? And it'd be great to know. Let's see. Yeah.
So I'm wondering how many prevention workers have been hired so far?
85.
85. Wow.
We've
that's
got
impressive.
85.
And then are they,
Would you like to be one? Come work Children's Division? No?
I'm retired from DMH now. I'm
Oh, come on, man. It's
done
great
that.
work. Look how,
So, and then I wondered, in terms of the prevention services that they will be providing as well as others, how are we growing those evidence-based programs? Are they being trained in some evidence-based approach that might be, program that Greenhouse has identified as a
Well, right
program
now-
that we can pull money, get those federal funds from?
right now, we're training all of them in team decision-making meetings, right? The 100. And as we accumulate more of them, we'll get them. But motivational interviewing is on the clearinghouse. And so we're going to, I mean, it's that kind of thing. We're going to inch into this, but you know, we're talking about all kinds of things that are on the clearinghouse. How can we replicate it? How can we do it? How can we get things we are doing that we know to be effective on the clearinghouse, and draw down those $40? It's an ongoing conversation.
Hi, so how do you see racial biases playing into this process, and then how would you be addressing those?
It's all over the place. I mean, you can't deny it. You can't, the numbers show it. If you look at it just numerically, Missouri doesn't look as bad as some other places, but it's a disparate impact. It's clearly a disparate impact. And I think that we've got to be mindful of it. We're looking at doing trainings with regard to it. We're talking with Casey Family Programs about what are things that we can do with regard to it. But I'm hopeful for this. I'm really hopeful for this because, I came from a community that was 98% white, right? But I saw disparate impact based on geography, based on your zip code, based on your last name. I had a CASA volunteer from South saying, you know what, if your last name, interesting, Missy was one of the names that gets mistreated in this county. Missy Coleman or Sansusi, if your name is that, they know you people and you have to be doing wrong. Well, to get that out of people's minds is something we got to continually work on and press on. But my hope is that by taking a completely different approach, it's going to be good for everybody across the board. But we got to be mindful of the disparate impact that exists with regard to race and several other things. So,
Get you, Miss Cynthia.
I'm having so much fun. I could do this all day, Gary. Are they going to kick us out of here?
Well, no, but some students they have class at
Yeah,
1 o'clock.
If you've
so
got
they-
class, you can just stay. I'll do this. I'll do this as long as you want, as long as Gary will let me.
Related to the hiring of the 85, when I was a foster parent, and I was for over 15 years, most of the people that I work with identified themselves not as child welfare workers. They identified themselves as social workers, which there's a big difference. So can you give me an idea, what's the ideal profile of the hires that you're making now?
It's a good question, because it used to be that when I got in trouble for calling everybody a social worker because they weren't a social worker, because they didn't go to a school of social work. So now they're a case manager, and they happen to, so it was an expansion. It was an expansion of our credentialing, of saying who can come do this work. It was an expansion to include people who had degrees in whatever. Well, I got a degree in political science. That doesn't qualify me necessarily to come do this work, but I could walk in and just do this work, and we're hoping to impact them through the training. That being said, there's a lot of encouragement on getting people their degree. Now, the other thing that happened was that, and this was leadership from, this comes directly from the governor's office, was that we, because accreditation, no states are accredited. States aren't accredited, but we were doing that, and part of that was our people had to have a degree, but it could have a degree in horticulture. That doesn't make any difference, and so we got rid of accreditation. Now you don't even have to have a degree to get started, but you can have, you can have similar work history that would justify us, for years of education, but. We're encouraging people to study this stuff, to study social work, and we have to put a personal emphasis on it because it's not a requirement anymore. And we're trying to work on it in our own internal training and make sure people have what they need.
I know that there are some potential issues with this, but are there any efforts being made to have any reciprocity with temporary placements with relatives outside of Missouri?
Yeah, so the legislature last year passed a bill. They keep passing bills to tell us to place with relatives, which they didn't have to tell me. I knew that's what you're supposed to do. But they keep passing bills, and they keep passing bills. And one of the people in our office began to call it the "we really mean it" bill. Place with grandma, and we really mean it. Really do place with grandma. But the thing that gets in the way, of course, is the Interstate Compact on the Placement of Children. If you've never heard of that law, it's terrible. If I were governor of Missouri, I would say we're going to withdraw the 49 of the rest of them, because nobody could dump on us enough to make us think it's okay that we got to wait 3 months for grandma, or 6 months, or whatever, when she's right across there in Belleville. But what they said is now, in addition to you place with relatives first, place with grandma first, they say you place with grandma first, and you send every relative a notice, certified mail, that their person is in care, and they get to respond to say whether or not they want to be considered, and that state line doesn't matter. You're going to do the ICPC process whether you like it or not. And so it's going to take a lot of work, but I think it's good policy.
So can we give Judge Darrell Missey a nice round of applause, and thank you guys sharing such incredible information. Darrell, maybe we'll stick around for a few minutes in case there are folks that want to come up and ask some questions.
I will stick around. I'd love to talk to you about whatever it is that's on your mind. But thank you for being here. Thank you for having me, and thank you for being interested in this. I think this really matters, and I just appreciate you all being here today. Thank you all.